Hi, everyone. We have Katie Walker here today from the Mental Health and Recovery Services Board. She's going to share some information with us about substance use disorders. Thanks again for joining, Katie, and I'll turn it over to you.
Okay, well, thank you so much for inviting me to talk about substance use disorders and some of the stigma associated with them. I am the program director here at the Mental Health Board for Allen, Auglaize, and Hardin County. I've been with the board for about 1.5 years now. And prior to that, I worked for a little over 10 years in community behavioral health at Coleman Professional Services here in Lima. And so first I worked as a case manager for individuals with substance use disorders or with severe and persistent mental illness, in addition sometimes to substance use disorders. And then I got my license in chemical dependency counseling. So I did some individual and group counseling for substance use. And then finally, while I was working there, I worked as the director of recovery services, developing a case management department for substance use, and working some with criminal justice, reentry from prison and jails and things like that. And then working with our liaisons for some of the specialty courts here in Lima, in addition to some programming there. Here at the board, I primarily work with schools, have some other roles here, but still working with substance use and working with mental health. So I'm glad to be here. Thanks for having me. So I understand that some of you guys might have read the community read, Everybody's Son. And in that book, it talks a lot about the complexities and stigma associated with substance use. So I wanted to just share some general information today to kind of hopefully work towards becoming part of the solution and breaking down some of that stigma. Okay, so hopefully, okay. Might have clicked too many times, but hopefully my screen changed for you. So the first thing that I wanted to do, because I'm going to continue to be bringing this up, is just define substance use disorders. So according to the DSM, substance use disorders impact an individual cognitively, behaviorally, and physically or physiologically in a variety of different ways. And the behaviors that are associated with substance use continue despite having problems as a result of that use. So on the screen here, I have a couple of the criteria that's used in determining whether or not a person has a substance use disorder. And the first one is craving to use the substance. And I think that we can all relate to having cravings, maybe a special food or your favorite restaurant or some kind of thing sounds really good, and you make a special trip to go there after work, or maybe even you're at home and you just decide, I got to get out because that just sounds so good. So the craving to use the substances is kind of like that, but just, significantly stronger, kind of depending on the use. Maybe you're wanting to cut down or stop, but not managing to. So really trying to set a plan and saying, I'm going to do that. And the day passes by and, we just don't accomplish it. And that starts to happen, day after day in kind of a pattern. Maybe you're taking the substances in larger amounts or for longer than you meant to, so maybe a medication is prescribed, a pain medication is prescribed to take every 4 to 6 hours as needed, and we just start to take it every 3 hours and until it kind of eventually spirals out of control. You could be neglecting other parts of your life if you have a substance use disorder, like coming into work late or calling in sick, or maybe you did things around the house like mowing the lawn, and the stretches start to get longer and longer before you get that accomplished. Continuing to use even when it causes problems in relationships. So it's normal if there's a person in your life that has a substance use disorder to express concern, especially for a spouse or a significant other, parent, sibling, good friend, just somebody that's close to that person because they care, they're concerned about the changes that they're seeing, And when they express that concern, the person who's struggling with a substance use disorder might take offense to that. You know, we want to feel like we're making good choices. We always want to feel like we've made a good choice, and we want to defend our choices. So it can cause conflict in the relationships. Another thing is using substances even when they could put you in danger. So substance use disorders can be mild, moderate, or severe. And again, these criteria in combination with some other factors like the length of time that this has been going on, the quantity, the frequency, how many of these behaviors, how often are these behaviors occurring, would determine what type of substance use disorder the person has. In addition to that, a person could have more than one type of substance use disorder. So I've got some substance categories here. In your depressant category, you're going to have alcohol, some of your anxiety, sleeping medications. For stimulants, cocaine, crack, methamphetamines, caffeine. You know, obviously they're going to have different effects based on the potency of the substance. Your narcotics are there, hallucinogens, cannabis, all of those kinds of things are different categories. So a person could have a alcohol use disorder and an opioid use disorder. And I'll talk about the effects of some of these things later, but I just kind of wanted to be able to define that before we moved too far into this. So I mentioned at the beginning that in the book, Everybody's Son, the stigma and the stereotypes, the perception that some of the characters had against a character who was struggling with a substance use disorder really didn't end up being the reality in the long run. And I think that is many times the case. So what I've shared on the screen here is something from the American Society of Addiction and Medicine, but terms not to use in terms of when talking about somebody with a substance use disorder, in terms to use, so that we can have a more positive perception towards people who have a substance use disorder. You know, and I think that we can observe this stigma in a lot of different areas. So maybe in conversation that you're having, or it could be on TV or on social media. I know some of the things that I've heard people say is, you know, well, they chose this, and there's all kinds of people with all these diseases, and poor them, but this person, you know, can have a choice to do this or not, you know. We're calling people junkies, you know, I don't want to support those junkies with tax dollars, or, you know, those kinds of things. Really using phrases that devalue that person, you know, as a person. You know, one of the other things that I've seen, and it's been a little while since I've seen this, but on Facebook, the EpiPen versus the Narcan debate. And while, you know, the cost of the medications is not the purpose of my discussion, it's more of the comments that are associated with it. You know, well, people could be revived multiple times, you know, with the medication. Just why continue that cycle? You know, that's really not showing value for, you know, that other person, or compassion for that person. So there's just a lot of stigma about someone that has a substance use disorder, and what types of things, you know, what type of value they might have. You know, and there's lots of different, I think a lot of people have beliefs about why they think a person begins using substances, and really it's for so many different complex reasons. And so I'm hoping that we can maybe kind of expand our perception on that today. So looking at another perspective here, you know, substance use impacts a lot of people. So not only the people who are struggling with the disorder, but their family members, people that care about them, are all impacted as well. And really, I've shared some statistics here, but it indicates that this is a real problem, you know, and we can all be part of the solution. But almost 21 million Americans have at least one addiction. 88,000 Americans die each year as a result of alcohol use. 130 Americans die each day to an opioid overdose. And speaking of that, you know, 80% of heroin use started with a prescription pain medication. So we're kind of in a state that's stemming back to the, you know, the early 90s right now, when prescription pain medication was being prescribed by physicians who were under the assumption that this was not addictive. And of course, we know that it's highly addictive now. But at that point in time, it was being prescribed more freely. And so just really people from all walks of life, all socio and economic status, all races, all genders are impacted by addiction. And so it really could impact anybody and anybody's family member. And it really did kind of stem into the opioid crisis that we've seen more recently today. I also have 5 million Americans are regular cocaine users. About 964,000 Americans are addicted to meth, and about 10,000 Americans who regularly used meth suffered a fatal overdose in 2017. So people are, dying from this disorder and really struggling. Substance use, like I said, starts for a variety of reasons, peer pressure, cultural reasons. This is the way that we celebrate, prescribed medication, self-medicating for other mental health conditions, all of those kinds of things. But it's not the only illness that has to do with choice. So in fact, other illnesses are choice related, and 7 out of 10 of the leading causes of death are diet related. So about the choices that we make based on what we choose to eat. So let's explore 2 of these illnesses and just kind of see where our choices can contribute. So I've got substance use disorders versus heart disease here. So psychologically, there are a lot of areas that impact our choices to use substances. So, we may use substances to cope with stress or cope with abuse or maybe some other negative feelings that we have, or divorce, separations, breakups, depression, anxiety. Maybe we use it to relax. There's lots of different reasons why a person could choose to use a substance psychologically. Socially, maybe this is a part of the celebration, maybe that at family gatherings, we choose to, drink alcohol or, whatever kinds of things. It has to do with our surroundings and the social settings that we're in, the peers, the people that we're around. What are they doing? Impacts our choices as well about how much and how often we choose to use the substances. There's a biological component to this as well, which we'll get to in a little bit. But when we look at heart disease, there are different things that impact our susceptibility to heart disease as well. So stress, it can increase your blood pressure, and you could be, dealing with stress, which could contribute to developing that. Socially, our lifestyle and our peers impact our choices on what type of foods we eat and whether we exercise and, how much sleep are we getting, and do we smoke, and, all of those kinds of things. There's a biological component here as well. But when we think about heart disease, we know what can we do to reduce our risk of developing heart disease. So we know that, we should eat whole grains, or Cheerios and all that kind of stuff. We should get 30 minutes of cardio exercise every day, get good sleep, eat fish and, chicken and different things like that, fruits and vegetables, all those kinds of things to reduce our risk of developing heart disease. Avoid fried foods, avoid red meats and all those kinds of things. So even though we know what to do, it can be difficult to actually accomplish that. And it's similar with substance use. So this brings us to more discussion on how we get to the point where the substance use becomes a problem for an individual. So how does the person get to the point where they're diagnosed with a substance use disorder? They meet the criteria for that type of diagnosis. Well, again, while there are many individually based reasons for choosing to use, the environment, the cultural expectations, the exposure to use, peer use, using to cope with trauma or other, mental health conditions. The simple answer really is the quantity and the frequency of the use combined with the biology. So your quantity of use is how much and how much of the substance you choose to use, and the frequency is how often do you choose to use the substance. And so that interacts with the biology too, So What is the family history of use? Individuals with one biological parent or grandparent with a substance use disorder are 4 times more likely to develop a substance use disorder if they choose to use. So of course, if you never choose to use substances at all, you're not at risk. You're not going to develop a substance use disorder unless, you've made those choices. But once you made the choices and how it impacts your biology, will start to determine whether or not there's going to be a problem. And so the more the family history, the higher likelihood that you could develop an addiction. Tolerance is another factor here too. So, as you increase your quantity and frequency, your body increases its tolerance as well, but you also have a natural tolerance. So let's just say that 2 individuals about the same age, same size, let's just say they ate about the same thing that day to kind of eliminate other factors. And it's the very first time that they're using alcohol. And they each have 2 12-ounce beers. One person, they could each be impacted very differently. So let's say one has a high natural tolerance and the other, does not. That person might be starting to feel kind of a little dizzy or just thinking, oh, okay, I think I've had a little bit too much, or this is really impacting me in a different way. The other person, if they have a high natural tolerance, might not be experiencing that type of thing. So that should be concerning for them, because tolerances are a mechanism in our body to protect ourselves. It's something that's there to kind of say to those symptoms are happening so that we stop putting the substance in our body. If that's not working, or if it's a higher natural tolerance, or we've built up our tolerance, we're going to continue to use more. Our quantity and frequency will increase, which, eventually can result in some problems. So now that we've covered that, then what a substance use disorder is and how we get there, let's talk a little bit about the effects of use. So I'm looking right now at the effects of the actual occasion where you're using. This is easiest to imagine with alcohol. But really what happens when you're consuming a substance or consuming alcohol is your brain is being put to sleep from front to back. So the first part of your brain that's impacted is your frontal lobe. And so that's where your intelligence and your logic and your reasoning and your judgment are present. So as that part of your brain is put to sleep, you begin to react to things based on emotion. So what feels good, your decisions are based on what feels good and how that's working. If you continue to consume alcohol, that part of the brain is put to sleep and your motor skills are affected. You slur your words, become sick, stumbling, those kinds of things. It's at that point that most people would stop using the substance. But if not, it could eventually result in coma and could result in death. That's kind of why binge drinking or drinking a lot quickly, where your body doesn't have time to respond and kind of catch up, can result in some of those things. But that's what's happening during the use. Physiologically, your brain's just gradually getting put to sleep from front to back. Now, if we use over time, our brain is impacted. It's impacted each use, but it's also impacted differently over time. So just to kind of get an understanding of this, our drugs affect the chemicals in our brain, and our brain is responsible for keeping our moods in balance. So if a person's feeling mildly depressed, the brain knows that it needs to transmit chemicals to make us feel better. And if a person's feeling slightly anxious, the brain transmits chemicals to kind of calm us down. So our brain is naturally just kind of fluctuating, and it's responding to keep our mood in balance. So if someone has anxiety or depression or other chemical imbalances, that monitoring is lacking. So maybe a person's mood, instead of fluctuating like this, is if they're anxious, it's going way up high, and it's having a hard time getting itself back to that kind of normal kind of fluctuation. Or for depression, maybe it's going way down. So those are some of the things that are happening with that. But drugs that we're using, so many of the drugs that are abused have a similar function to a natural chemical in the brain. So I'm just going to give 4 examples of that. Dopamine is similar to your stimulant, so amphetamines, methamphetamines, cocaine, things like that. Serotonin is similar to your depressants, alcohol, Xanax, Valium, sleeping pills, all those kinds of things. And your endorphins are similar to narcotics like heroin and the opiate pain medications. Anandamide is similar to marijuana. So when we abuse alcohol or other drugs, over a period of time, our brain believes that we're taking over the production of those natural chemicals with our drug of choice, whatever we're using. And that results in a lack of regulation or monitoring of our moods. And so our brain goes on vacation and it eventually stops producing those natural chemicals. So we're just kind of left hanging when we come off the drug. There's no natural chemical to regulate the mood. And so it's lacking that backup supply from the brain. And without that natural chemical, individuals crash and crave more of the drug and try to do the regulating, try to do the self medicating just to feel normal. They're trying to get their mood back to that normal realm. And that cycle will continue until a person allows himself to withdraw from the drug and allow the brain to begin to produce those chemicals again. So I'm sharing a screen here that shows some different images of the brain, and this is something that you could Google too if you are interested in it. Brain scans and recovery, or those kinds of things are different keywords that you can put just to kind of see how the brain is impacted. But the first picture on my slide is showing in the middle a normal brain, and I don't know if you can see my arrow when I do this, but there's a normal healthy brain and it's showing how it's functioning, and then the normal bottom of the brain, and then it shows different images. And again, these are not holes in the brain, it's just showing that there's a lack of chemical production activity, those kinds of things in those areas. So of alcohol in a 38-year-old, so 17 years of heavy weekend use, and a 24-year-old, 2 years of frequent cocaine use, 38-year-old, 6 years of opioid use, marijuana, a 16-year-old showing 2 years of use. So it's kind of showing how the brain can be impacted. And the next picture is a little bit blurry, sorry, but it shows kind of normal brain activity in a different type of scan. And then it shows, like for cocaine abuse, after 10 days of abstinence, you see part of the activities returning. After 100 days of abstinence, we're seeing even more activity. So it does take a period of time for the brain to begin to use those natural chemicals as well. So in addition to the effects on the brain, there are some other effects that individuals can experience as well, based on the substances that they're using. So I'll talk a little bit about the effects of some commonly used drugs. So your sedatives are things like anxiety medication and sleeping medication. Those are the benzodiazepines and the barbiturates. So the effects are similar to alcohol use. So they're all depressants. So again, when I talked about that stable mood, when you're using one of these substances, you're bringing yourself down, out of that normal realm. Is the easiest way I can say that. It does cause impairment, and it depletes the serotonin level and leads to an anxious state without the natural sedative in the brain. Causes confusion, disorientation. So when you're using a depressant or a substance like that, and again, it's bringing you down out of that normal realm, as far down as you went, as you withdraw from that substance, that's how far up you're going to be. So if a person is feeling hungover, they might be feeling anxious or jittery, or things like that, because their body is trying to figure out, how to get back to that natural production. It takes some time to be able to do that. And the longer that a person uses, the longer it takes to kind of get your brain back into that kind of healthy and natural response for your moods. Marijuana, the effects here are calm euphoria. It does impact your short-term memory. It impacts concentration. It can cause a person to be overly focused and kind of just zoned in on something and not aware of other surroundings. It can slow the reflexes and response time, can decrease motivation, and be an appetite stimulant. Narcotics can cause drowsiness, nodding. They can depress the respiratory system, thus an overdose can be fatal. They can cause constipation, itching. They're highly addictive when used for euphoric purposes, and you begin needing not just to put off the withdrawal, but to be able to function at all. There's a severe flu-like symptoms are the withdrawal from your narcotics, which again is your heroin, it's the opiate pain medications that would be falling under this category. The stimulants again are like cocaine, crack, methamphetamines. Caffeine is even a stimulant, but again, they all have different potencies. So they affect the pleasure center of the brain. They increase your heart rate and your blood pressure, your metabolism. Methamphetamines can kill some of the neurons in the brain, but with the stimulants, if we think about that normal place with your mood as well, the stimulants are going to bring them up out of that. So the withdrawal from that's going to result in feeling, depressed. And it does take time to, like I said, get back into that normal range of things. The hallucinogens there are all kinds of different hallucinogens, but some examples are LSD, ecstasy, mushrooms, PCP, those kinds of things. But the effects are to cause hallucinations, so seeing, hearing, feeling, smelling things that are not there. They can cause delusions or a distortion of reality, feeling like you have superpowers or something like that. MDMA and PCP are addictive, and others could lead to mental illness like schizophrenia. It is unclear how these substances might permanently affect the brain and the neurotransmitters. So I feel like I went through that fairly quickly, but we talked about what a substance use disorder is. We know that stigma exists, and we know that this is really physiologically causing problems in the body and with other areas of life. It's impacting our behavior and all of those kinds of things. We know that this is widespread. It impacts a lot of different people, but it is possible to recover from this as well. And there are lots of treatment options locally. Services include outpatient counseling, case management, peer support, medically assisted treatment, medically managed withdrawal, detox, recovery housing, connection to residential treatment. And that's just kind of a short list of all of the different options of different things, services that we have locally. There are links to a lot of agencies on our website at wecarepeople.org. We also have information at times on our Facebook page, again, We Care People, and Instagram. So there's always information there going out. There are screenings, free screenings for mental health and for substance use on our website. So if you want to take one, or if you want to take one on behalf of a loved one, you can always go on our website and take a screening to see whether or not maybe treatment would be a good idea for that individual, for yourself. So there's lots of ways to be able to do that. There's also lots of new behavioral health agencies for substance use coming into town. So lots of different options there. The last thing that I want to share too is I provided a lot of general information today, but a couple of the individuals that I've seen speak in the past that I feel provide just a different perspective, a different way of thinking about things in terms of addiction are Dr. Nicole Labor with her presentation called Addiction 101. You can just type that into YouTube and get multiple videos of her giving that presentation. So that's something that you can look at if you want more information on addiction. Also, Dr. Brad Leander has a presentation called Understanding Addiction, Squirrel Logic, and you can do the same thing on YouTube for him and be able to get some presentations from those individuals. So those are really hearing the experts speak. a little bit more thoroughly on this if you really want some more information. So at this point, I will take any questions on anything that I discussed today or any information that you want about what's happening locally.
And just a reminder, if you had any questions, you can go ahead and unmute yourself. No pressure though. All right, we might just not have any, which is fine. That was really informative though. Thank you so much, Katie, for putting that together and going through that with us.
No problem.
All right, well, I guess if we don't have any questions, we'll go ahead and close out. And then this will be available on the library Facebook page for people to watch if anyone missed it. So thanks again for joining us today and hosting that presentation, Katie.
No problem. Thank you for having me, and hopefully that was helpful information.
Yeah, it was great. Thanks so much.
Okay.